Good afternoon, everybody. Welcome to Think Local Act Personal's webinar, the latest webinar that we produced, Understanding Rights and Entitlements in Self-Directed Support. I'm Martin Walker. I'll introduce our guests in a second. Just a bit around housekeeping before we get to introductions. Please do use the chat box to ask questions as we go along. Let's have lots of questions. We see plenty of people already logged on from across the country. So we're going to have a conversation this afternoon about self-directed support. So I'm really pleased to be joined this afternoon by two colleagues. I'll let them introduce themselves if that's okay.
Hello everyone, my name is Svetlana Kotova and I'm Director of Campaigns and Justice at Inclusion London. Inclusion London is a London-wide disabled people's organisation, which means we are run and controlled by disabled people, and we campaign for disabled people's rights and support smaller disabled people's organisations in London.
Hi there, my name's Peter Gay. Really nice to be here. Thank you, Martin. Really good to be with you, Svetlana. I'm from the Personalisation Partnership, and we work with all sorts of different organisations around social care and direct payments. And yeah, hope we can have a good conversation this afternoon.
Great. Okay, so let's move on. So this webinar really has come about because we had, as part of Think Local Act Personal's work around self-directed support, an event in London, one of our regular national forums. We did that jointly along with the London Self-Directed Support Forum, which is an independent group of organisations and people. And Peter and Svetlana came along and spoke at that. We were really looking at practice to try and get past what might be considered as the system being stuck around self-directed support. And both were very popular sessions at that event. So we thought we would ask Peter and Svetlana back and see if we could share those experiences and give more people opportunity to ask questions. So that's how the sessions come about. Just a couple of other things in terms of accessibility. If you have any accessibility issues, for those that have signed up, we aren't aware of any particular accessibility issues. But if you do need any support, please do use the chat box just to let us know if we can help in any way. But as I say, do keep your questions coming in. Each speaker is going to talk for about 15 minutes. If anything particularly, any rocket science crops up, we might just interrupt the sessions. As I say, we really want to have a conversation, but there'll be plenty of time at the end for questions. Just be aware if you are using the chat box. Just be aware that your name does come up, and we are recording this session, and we will put the presentation or the webinar out via our website. So if you don't want any contact details sharing, please don't type them in the box. Okay, so if that's all clear, then we'll move on, and Svetlana's going to talk to us about her experiences at Inclusion London.
Yeah, thank you very much. So I think my presentation will be a lot of kind of moaning about problems because most of my work is to go and train disabled people about what rights they have under the Care Act, and also try and help groups around London to campaign for better social care and better self-directed support. So I will start with one basic idea that we all believe in, and we think all professionals who work with disabled people should know, and it is a social model of disability, which basically says that disabled people are disabled not by our impairments, but we're disabled by the barriers that exist in society. And we think all support that we get and all the policies that are there to make our lives better should be built on this basic concept. So for us, social care support is about removing barriers that we have and giving us the same choices and opportunities in life as everybody else. Next. Martin. Martin is helping me to move a slide, so thank you very much.
No problem.
We also call social care support independent living, and we think it needs to change a little bit to actually be independent living. But it's important to understand what independent living actually means for us. And for us, it's not about just living in the community. So we hear a lot about someone lives independently in the community, but when you go and see how that person lives, they're effectively trapped in a house and they don't get out anywhere, and they don't even decide sometimes when do they go to bed. For us, it's not independent living. It's just that person lives in the community, not in a big residential institution. It's also often said that independent living is being independent, so less reliant on support. So if you learn to do things for yourself and support yourself or cope with your situation, then you will live independently. Again, this is not what independent living is for disabled people. For us, it's getting the support, necessary support that we need to have choice and live a life of dignity and be able to do everything that non-disabled people can do. So it's about not only just about being clean and fed, although this is really important as well. It's about being spontaneous, being able to go and meet friends, being able to go and get education, get work, do something for community. We, of course, would like to see social care support that people get to promote the right to independent living. Okay, let's move to the next slide, which will be about problems. So when the CARE Act was introduced, we did hope for some big changes because there were some key concepts in the CARE Act. First of all, duty to promote well-being, and again, when the CARE Act went through Parliament, we had campaigned really hard for that duty to be about promoting independent living as we see it, and it wasn't taken, but in the guidance it does say that well-being duty should be interpreted in line with what UN Convention on the Rights of Disabled People says about independent living. So there is some connection with well-being duty and independent living. Well-being duty, of course, is very important because it talks about professionals starting with the assumption that person knows their needs and what's good for them best, thinking about individual circumstances and taking them into account, thinking about emotional, physical, mental well-being, making sure a person can participate in society and can be an active member of family and so on. So there are so many aspects of this duty that could make lives of disabled people better. There is also this system that was envisaged under the CARE Act where disabled people and social workers or other professionals would work in collaboration and design innovative ways of support. And so there are duties to involve disabled people in decision making. And of course, CARE Act was supposed to be person-centered, so all the process must be around what's best for the person. So what we see in reality is that well-being duty, and we even had to support some litigation around that. And at the end of the day, although person's circumstances must be taken into account, at the end of the day, it's social worker, local authority through social workers who decide what's best for the person. And even in a situation where a person disagrees passionately, there is not very much they could do. Assessments, unfortunately, are driven by resources, and we sympathize with local authorities. Of course, there isn't enough money to support everyone as we'd like to, and we see that needs are changed in a way to cut the packages. We think that all needs should be assessed and recorded, and so then we will see what the gap is between the needs that are met and unmet needs. There is no time effectively to involve people. Most of the cases that I see is that people get assessed where they tell what their situation is, and then sometime later they receive the care plan and they're told that this is going to be your support, and you can't say much about it. Also, there is no effective way to challenge decisions. The CARE Act does have a section which allows the government to introduce regulations to introduce the appeal system, but that hasn't happened. And we think current systems, through challenging through complaints or judicial review, do not work well, because they're either too adversarial. So if you go and instruct lawyers, and it becomes too formal, and not everyone could do that, where we want people to sit together and talk and find solutions together. So the next section is about what happens with self-directed support. Unfortunately, I come across more and more people who say that they don't see the point in having a direct payment anymore, because conditions are so restrictive that it doesn't matter whether you get support arranged by local authority through agency or you get direct payment. It's just with direct payment you get a lot of other responsibilities and take a lot of risks. So you kind of take on huge amount of work, but you don't see that many benefits as people used to. So what's that about? So the lack of flexibility. We come more and more across the care plans which are so prescriptive to the hour when people should get support. So 3 hours in the morning, 1 hour in the afternoon, and 2 hours before bed. Sometimes they even specify times when that should happen, and then local authorities would insist that people spend money in exactly that way. So there is no choice. People don't have choice to just be lazy, for example, and spend all afternoon or morning in bed, and then next time go somewhere and use that hours to do something else. So very, very prescriptive care plans, and these very prescriptive care plans enforced by local authorities. Fixed rates, no matter, sometimes there are no official policies, but people are told we just only pay this amount of money and we don't pay more. Policies like we would only give direct payment to pay for personal assistance time, but we will not pay for anything else. And again, I came across many cases where people say, well, yeah, I could get PA, but sometimes if I buy some kind of equipment, or if I go somewhere, like even to the gym, that might make my life so much better than just paying the personal assistance. So very little flexibility. Well, I put no support for direct payment use. Well, actually, there is usually support, but very poor quality of that support means that people just stop trying to get it. So information about what your responsibilities are as employer, it helps to just recruit PAs, what you do, because people effectively become managers in a situation where many disabled people, and me included, we live our life being told what should happen to us and having very little choice and control, and then suddenly you become responsible for everything. So there needs to be not only just information, but kind of peer support and support from people who've been there and who've done it, and just emotional support as well. Clawbacks, and we even had to get some legal advice on this, because reality is such that for all kinds of reasons there are money that is accumulated on direct payments accounts. So cases like people are struggling to recruit for many months, and that money is saved on the account, and people are not able to spend this money. So I had a case where someone told me, well, I can't recruit for several months. If I would use this money to increase the wage, I could pay a bit more, I would definitely recruit someone, but that is not allowed, that doesn't work. And then this money is taken back. And so people live without support for a long time, and the money that was supposed to go towards supporting them, towards paying them, the direct payment, is taken back by local authority. Prepayment cards, again, they might be very good for some people, but not very good for others. And unfortunately, we see that there is very little choice that people have, despite what the Care Act guidance says. People are told they would either have this or this is just, no, people are told this is what they're going to get, and that's it. And people have to go to the ombudsman to challenge those decisions. That shouldn't be like that. Okay, I think we'll move to the next slide. Oops. I'm making noise with this presentation.
Sorry about that rustling.
So we did take some legal advice on the key problems that disabled people came to us with. And this legal advice is available on the website, and I think I put a link to it. But basically, in terms of clawbacks, we were told that local authority can claw back the money, but it's when a person breached condition, one of the conditions of direct payments. So it could be conditions in direct payment agreement or conditions in regulations, not just the money that's accumulated because person did everything they could and but still couldn't spend the money. Local authority cannot reduce direct payments on the assumption that carers could do more. We see more and more of this, and we see people pushed to kind of asking friends and asking neighbors, and sometimes this not discussed. We know the Care Act says that local authority doesn't have to meet the need if it's met by carers, but carers need to agree to it, and it needs to be a workable situation. Local authority cannot have fixed hourly rates, and we know that, but people are told this is our policy, so that happens. Local authority cannot cannot force people to spend the underspend in a certain way. So we usually see what happens with the underspend is that direct payment is reduced, and then people are told, well, you spend your underspend on your support in the next, say, 3 months. But that should really not happen, and people should be able to have some flexibility of how they spend this money. Of course, we understand that this money has to be spent on meeting the needs, so people can't just go and buy whatever they want. It has to be spent on meeting the needs, but there must be some choice and control in that. And local authority cannot force disabled people to accept a prepaid card. That's been told by many places, like an ombudsman. We had, well, again, advice from barristers, but that still happens. Okay, the next slide is this. We understand local authorities are in difficult situation. There are budget cuts. Local authorities absolutely have to make sure public money is spent appropriately, and we do appreciate that. We know that it's sometimes easier to go for an easy option, so just commission a big expensive package from a known provider instead of trying to develop individual package that might fall apart next day. And of course, there are risks, and it's easier to go for something that's known and safe. And there's a lot of talk about kind of money spent not appropriately, or and we know that it needs to be taken into account, but it shouldn't be the main driver for policies. So what are solutions to get unstuck? So first thing is engage meaningfully with disabled people, with service users, with their representative organizations, like Hammersmith and Fulham, for example, did, where they established Disabled People's Commission, where they did a review of independent living support, what they call it now, direct payment services, where now they are working at the top level to the bottom to change the system, and they are the only one local authority we know of that does not charge for social care, and they did find the money for that. And this was all done in meaningful work engagement with disabled people, local residents. Be on disabled people's side. Sometimes it feels like all the decisions are driven by finances, and these decisions do impact on people's lives. And it's important to remember what the impact is, and just think about that. And sometimes, if you can't do something, just explain and find solution together with the person rather than just imposing something on people where they don't have control or choice or feel like they just have to follow what they're told. And flexibility, there needs to be flexibility in care plans. You can spend the same money on very restrictive care plan and very flexible care plan, and the person will feel very different. They will have very different kind of outcomes and the quality of life if there is flexibility. And for us, we want to change the system. We campaign for National Independent Living Service. We think it should be modeled on Independent Living Fund, which one of the kind of great examples how disabled people should be supported and how person-centered support should work. And today we will launch our manifesto. I'm sorry, I'm using this space to say this, but you can look at it and see what we're actually campaigning for as disabled people. Thank you so much.
Thank you, Svetlana. Yes, there's the last slide with some of the links and resources that you've been highlighting. We have got one or two questions that have come in. But we'll just hold on to those until the end, if that's okay. Peter's going to now tell us about his experiences working as in Personalisation Partnership. Sorry, I can't say that. Sorry, that's Svetlana's contact details. Yes, the slides will all come out as part of the webinar communication.
Lovely. Thanks very much, Martin, and thanks, Svetlana. Brilliant to hear that, and absolutely agree and echo your thoughts about trying to find solutions by co-producing, talking to people, work with people, and also acknowledge there's a problem in the first place. Sometimes it's the first thing, and also great to hear you talking about peer support and expert advice is a really important part of the solution here. Great. So what I'd like to talk to you about is just some of our recent experiences working with a variety of people, a local authority and a direct payment peer support group, two specific ones, and to use our experiences and some of the insights we've gained from those bits of work to just talk a little bit about how the self-directed support systems are working, particularly reference to the Care Act. So yeah, Martin, next slide please. Thank you. So just briefly who we are. So myself and Kelly Munn are the founding partners of the Personalisation Partnership. We've been going for about 5 years as independent trainers and consultants, and we've been working very closely with Tina Martin, who's an advocacy and social care consultant on these bits of work. Our backgrounds are very much from a disabled people's organisation perspective. So I worked for 15 years in a disabled people's organisation. And also I worked for quite a long time initially as a personal assistant. So I've got a sort of insight into this world from that point of view, and I still do bits of work, so that still informs the way we think about it. Okay. So in terms of our work, we're not lawyers. You're talking about Care Act and referencing it, but absolutely not. We come from a position of practical expertise. So it's many years doing working in support services. So I've managed a direct payment support service for about 14, 15 years. And the other people working with me are very much experienced in advocacy and support planning, a similar, very practical knowledge, working very closely with people and building up our understanding of systems through that. So we work in social and healthcare, mostly around direct payments, but with other areas as well. Work in co-productive ways, absolutely. It's essential to the way we work. We facilitate peer support and deliver training. And we work with a whole range of organisations, so local authorities, disabled people's organisations, clinical commissioning groups, and national charities. So apologies, this slide seems to have come a cropper in the Mac versus PC world, but I'll just talk you through it. So one of the bits of work, been working with a direct payment peer support group. Actually in Hammersmith and Fulham as well. I've been doing that for the last year and a bit. And that peer support group had made a plan of how they wanted their peer support to work. And they'd done that over a couple of months. And so the image is supposed to be full of thought bubbles and explaining the kind of things people were after. So people expressed that they found peer support really handy for as a safe space to talk about difficult issues. They said they really were after training for employers. They said it was really good to have a group voice to talk about things. And just great to have a chat and find out about other things. But one of the things they come up with, they really wanted to understand more about the Care Act and what it meant for them. So they'd had a real mixed bag of experiences around assessments and reviews particularly, and also support planning. And that had left people feeling quite confused and frustrated. And they really wanted to know a bit more about what the Care Act said about their rights and what the process should be like. So we put together some training for them and trying to address those things that it asked for, and critically trying to help people become a little bit more confident about using what the Care Act says and within assessments and reviews particularly to try and help them with that. Yeah, thank you, Martin. And critically, coming back to the way we work, our approach is very much about understanding things from people's point of view, the people that are using social care or the healthcare system indeed. It's really important to understand what that is and what the stresses and strains of that are. And Tina, who did the particular bit of training with the direct payment peer support group, would start off talking about that. And so this is how she'd start off the training, talking about saying from personal and professional experience that assessments are tough. They cause anxiety, stress, because so much depends on getting them right. And what our emotional reaction to that is, stress, anger, anxiety, retreat, it's really stressful, difficult time. And critically, sometimes we accept less than we're eligible for rather than prolong a process that we're finding quite stressful. So all our training is really for the direct payment peer support group and other people is about trying to make it less stressful and trying to help people be more in control by understanding the process. And so the other bit of work we did was recently, in the last 12 months, been working with local authority, and we did some half-day sessions as a sort of direct payment training, an update really. And that was really interesting, coming from a similar point of view, using similar information and supporting them to try and unpick some of the issues they were having with direct payments. And it was great to get some good feedback from that, so people were really engaged with that, and again, it was really practical training. So our experience, again, Mac versus PC, it's changed the layout, here we go. Anyway, so we've put the two experiences together from working with people using social care and people working within social care. And what's quite interesting, we found that both groups of people would benefit from a better practical understanding of Care Act principles, and also aren't really very clear how assessments and reviews and support planning should be done according to the Care Act. Now, absolutely, in terms of people going through a social care process, wouldn't expect them necessarily to be experts on that, though some people are. But also, interestingly, people working in social care, whilst they, yes, pretty universally understood the Care Act and could talk about it, but in terms of the practical understanding of what that actually meant when you got down to an assessment or a support plan, how would that work? What would that actually mean when someone asks, oh, can I spend my social care money on this? How do they apply those principles? So they sometimes needed a lot more help to understand that. So that was interesting that we found that out. So hopefully this explains that a little bit. So we felt that everyone needs to understand better what person-centred looks like in practice, and person-centred is absolutely the core of what the Care Act is all about. And so it really says for two different people, having the same impairment or condition or even environment, included in that does not mean that you need to provide exactly the same support to those two people. And similarly, providing the same support does not mean that you're going to get the same outcome. That's what person-centered is about, and obviously it's about the, going into details. We haven't got too much time, but the impact on someone's well-being is exactly what the Care Act is talking about. And then maybe someone experiences not able to do something, but actually it doesn't impact on their well-being, where for another person it will do. So it's really about the tailored, personalised, person-centred approach and how to practically apply that. Thanks, Martin. So, and that person-centeredness is absolutely crucial to everything. So assessments and reviews, obviously. Good care and support plans, well, they're going to depend on a really good assessment. So you can't write a really good care and support plan if you don't get a good assessment and you're not understanding how people can use their support flexibly. And then, so flexible use of social care depends on a really good plan. So it's absolutely crucial in all those areas. And so what we've done is to put together training around assessment reviews, support planning and direct payments for both people working in social care and people using social care. And that training, I keep on talking about practicality, but it has lots of exercises until you get people to start thinking through scenario situations. We find people don't really acknowledge that they don't quite understand those what person-centered means. And so we've been talking very much about adult social care, but it's kind of like this is across the board for parents of disabled children, and also in health and personal health budgets. So we are very much looking at those areas as well and wanting to, again, look at the legislation and guidance and develop similar bits of training. So our goal is really that people using services and people using the social care system become better informed and more confident, and actually people working in those systems as well have exactly the same experience, become better informed and more confident. For people to know their rights more and be willing to challenge and to make better use of their care. And for staff, it's really important to be confident in applying practically the principles and the actuality of the Care Act, to be able to challenge within your own organisation, and to welcome well-informed people and their advocates. I think that's a really important part of the talking through and finding solutions. And so just on that, it's kind of like, so we are keen to put that out and try and support people to be better informed and more confident. We're not, there'll be people listening to this webinar, there'll be people near you that absolutely have that expertise and know about that. It's not about any one particular organisation, but it's finding that expertise and using that and helping people to understand better what their rights are. And coming on to some solutions, and if I've got a time, just whiz through a few slides at the end, just about some of the examples that we picked up from the Care Act. But solutions, so we really want simple, accessible information about what the law says, about what the guidance says, and what good services should look like to be available to people, and to have locally available guidance, advice and training to help people understand that. So giving people a handout or a PDF on the website isn't going to work for a lot of people using services. They're going to need help looking through that. What does it mean for them? What can they expect in their assessment or the review? And support to challenge poor practice and decisions. Absolutely agree that better to try and talk and find solutions, but sometimes a challenge is the only way. And a recent experience of working with a personal health budget user, when it did come down to only at the point of a legal challenge and a prejudicial review letter, did something change? And that was after a year and a half of work of gently nudging. So sometimes it is important to challenge. So if I've got a little bit of time to rattle through, there's more. So just a few highlights from the work we've done. Yeah, if you move on. So just some of the things we picked up. So just explaining what the Care Act is, and I think actually the more and more I go back and read the actual Care Act and the regulations and the guidance, the more I learn each time I go back and read it. And so people working in social care keep on reading it and keep on being aware, but understanding that the Care Act itself, the primary legislation, is supported by the secondary legislation, the regulations, and then the guidance fills in the gaps in ordinary language. But it is, if you're working in it, it is important to know what they are and what they say. It can be hard work going through it, but you do need to read it. And there's some brilliant phrases within the care and support statutory guidance that particularly really helped people using social care just to hear that these were in the guidance. So I'll just pick out the bottom phrase, so you'll have all these slides afterwards, but the bottom phrase, the core purpose of adult care and support is to help people achieve the outcomes that matter to them in their life. Now that's a pretty strong statement, and I really like that. Particularly for people using social care, again, just understanding what these things mean. So definition. So a review is not a reassessment and should not be used to make cuts to your care package. People were telling us they had social care staff coming to them, making appointments, and they didn't know what it's for, and that still happens. A reassessment, yes. So a review can prompt a reassessment, but not on the same visit. You shouldn't be receiving cuts to your care package in the same visit. Great, thank you, Martin. And meeting the needs. It's one of these terms that bandied around all over the place, and we think everyone understands it, but it's really important to understand what that says. And actually, the guidance has some brilliantly clear words on this. So. The concept of meeting needs is intended to be broader than a duty to provide or arrange a particular service. The intention behind the legislation is to encourage this diversity rather than point to a service or solution that may be neither what is best nor what the person wants. Yes, it's guidance, but it's really very clear. Just picking up little points again around assessments. So in the guidance, the local authority should provide in advance, in an accessible format, the list of questions to be covered in the assessment. I'd be fascinated to hear. So far, I've not found very many people that have either practiced that or received that. So I'd be really keen to hear what people's experiences are, and also about assessments that they need to be done on people's level of needs without any support that they're receiving, even informal support. Thanks, Martin, rattling through these. But that's a very text-heavy slide, very legislation-heavy, but it's about the primary legislation. It's talking about the Care Act and just saying, well, what's all this about? Why do local authorities have to make direct payments? So won't spend too long on that, but it's about meeting the 4 or 5 conditions, 5 if it's making a direct payment for someone who doesn't have mental capacity. But it's really important for people working within self-directed support to understand that and know where that comes from. And last few slides are on flexible use of social care. A lot of text here, but really, so within the guidance, it talks about saying people should be allowed to be very flexible, choosing innovative forms of care and support. And it even specifies also non-service options such as information technology, club membership and massage. And it says very clearly at the bottom, limited lists of prescribed providers that are only offered to the person on a take-it-or-leave-it basis do not fit with the government's vision of personalised care and should be avoided. So if anyone says, no, we don't do that here, there's a nice little bit of the guidance to just ask, well, why? And again, some more bits and bobs about flexible use. Brilliant statement at the bottom, 12.35 of the statutory guidance. A direct payment is designed to be used flexibly and innovatively, and there should be no unreasonable restriction placed on the use of the payment as long as it is being used to meet eligible care and support needs. Again, I plaster that all over everything I use because it's really a very categorical statement. And just finally on about making support plans. So these last few slides just talking about how genuine involvement will really support the process. It actually, people feel engaged, people feel it's their process. It's going to make it better. It's going to make for a better support plan. And further bits of discussion about how plans should include natural support. It's not just about spending the personal budget. It's all about saying a good support plan will mean something to the person that it's for. And lastly, you'll be glad to know. So it's really important. This is talking about the flexibility of the process of planning. So many people I've heard from recently are saying, well, I've had to use a template, it doesn't, it's very impersonal, and so this part of the guidance 10.37 talks about maximum flexibility should be incorporated to allow adjustment and creativity by allowing people to include personal elements into their plan, or by developing the plan in a format that works for the person rather than a standard template. Now, I remember 10, 15 years ago talking about planning as being the new big thing, and people making films and drawing flowers all over their plan and or whatever they wanted to. And I haven't seen any of that recently, I have to admit. It's all been in a template. And so it's obviously going to help people if they can write a support plan in a way that really means something to them. So I think I'm done. Rattled through those. So thank you very much, and I'm sure hopefully there'll be lots of questions and discussion there.
Please, yes. Thank you very much, Peter, for that experience. Both of you. Thank you, Svetlana, for sharing your on the ground experience. It's easy working for TLAP to get connected to a whole range of places, but just touch the surface and kind of hear about what's going on. Svetlana and Peter, you're working on the ground with people day in, day out, aren't you? So some real experience in the room. Please do keep your questions coming in. We've got a series of questions. We'll just move to that slide. Svetlana, is there a central place to find all the Ombudsman's decisions and case law?
Yeah, I think it's an Ombudsman's website.
That's a straightforward.
Thank you, that was an easy question to answer.
Can I just ask you, do each of you sort of also put information about the sorts of experiences that you're coming across each day in your own websites? I know. So for us at TLAP, we're aware of organisations like In Control, who are a partner of TLAP, but also a network. I don't know if we've got anybody on from the Cascader network, but I know lots of stuff is put on those websites too. Do you have a set of resources around?
Yeah, we do, and so we will publish independent living resources shortly, but we also organise on kind of more legal sphere. We organise legal network meetings where disabled people and disabled people's organisations and lawyers talk about the issues. So we had, for example, one on direct payments, and it's on the website. All the materials from it are there.
So, right. So we've just got a comment from Colleen. On the Ombudsman website doesn't have a search function, so it's hard to find stuff.
Yeah, I'd say it's not ideal. The search function there is you do have to troll for all the decisions. You could sort them by certain things, but yes, I agree.
Yeah. So maybe we'll complain to the Ombudsman about the website. Okay. So that's Colleen's question. So we've got a very specific question here, and I have to say I particularly find this area very confusing. The interaction of all the financial disregard type stuff Could someone address? We wondered if Svetlana, or whichever of you, but particularly we'll ask for Svetlana. Could someone address the problems associated with claiming disability-related expenditure as part of the financial assessment part of self-directed support?
Yeah, well, so this is just to put it in the context for everyone. So local authority does have a right to charge for social care, but the regulations, I think the guidance say they can't charge for more than what person can afford to pay, and there are amounts set by Department of Health and Social Care in that respect. And when they take into account disability benefits, so care component of DLA or daily living component of PIP, and some disability premiums, they have to make sure that they exclude disability-related expenditure. So different local authorities do it differently, and we find that disabled people on the ground have more and more problem with this. So some local authorities just give set the amount of money that they will disregard, so £20 per week, for example, or £5 per week. Some local authorities say that person has to show what the expenditure is, and they will decide it on an individual basis, and person has to show receipts and basically do like an accountant for everything that relates to the expenditure on disability, extra costs. Yeah, I think that's broadly how I see it. From our point of view, it's very inaccessible system for many disabled people, because you literally have to be an accountant. Do we all in normal life collect receipts and all the documents for everything we spend money on? We don't. And also some people don't understand what disability-related expenditure is, that they could claim for extra money they spend on electricity, for example, or heating, or maybe information technology. Unless it's something very specific related to disability, then fine. But if people need to buy something general, like general equipment, so I'd need a food processor, not because but this is something that will help me to cut food, because I could cut myself. So this, I could probably claim it a disability-related expenditure, but if I didn't know, I would never think about it. And so we think disabled people need support with that, and ideally, disregarding kind of larger amounts of money is probably the way to go.
Yeah, no, I was just going to say, so I remember when I was working in a direct payment support service some while ago, but and also actually it's even longer ago, because I worked in Amazon and Fulham, who got rid of charging. Just say that again. But so we didn't have to deal with it. But when we did, I did a lot of work supporting people with disability-related expenditure assessments, and yes, absolutely, it depends where you are. And so all I would say is to try and get to, I don't know what your policy there locally is, but to really make sure you understand.
Well, from the questionnaire, there seems to be a decision made by that LA local authority. Specific was around about spending £400 on power wheelchair repair. The LA took an approach where its disregard was spread over a 10-year period for that expenditure.
Okay, so I guess it's looking
and what they were saying is that distorts the amount of disposable income they've got at that particular point in time, I guess.
Cash flow issue in a way.
But see, this is where wellbeing duty should kick in there. I would say this is where you could say, well, but this will have huge impact on kind of all aspects of my life, because literally a person will be in debt, potentially. And so local authority needs to think, does that decision promote person's well-being or not?
Yeah. But in terms of trying to understand, we need to see the policy, and hopefully they've got a clear policy about how they administer disability-related expenditure, and know that really, really well. That was always my approach, to try and understand that, and I found I ended up knowing it better than the officers trying to administer it, and so actually was able to support people well. So it would really be a matter of going back to that policy, I think, would be my approach, to try and understand how to get you a better result of the DRE check. I don't know if that helps. But.
Thank you. So again, this discussion came in when you were talking, Peter. But you know, I'm sure you both have a view about this. What are your views on local authorities using prepayment cards as a way of cutting down reviews? That's the specific question.
Reviews, that's interesting. I mean, I absolutely, and I think I saw Caroline putting up the recent report on prepaid cards, which absolutely, from the Independent Living Strategy Group, through In Control, I think, published it. I absolutely support the fact that prepaid cards, as Svetlana mentioned, can be useful for people, but they should be an option, full stop. And the Care Act says as much very clearly. So it really shouldn't be people having to use a prepaid card when it doesn't suit them. It is not just about suiting the local authority. It can suit both. Some people really, really like using a prepaid card. That's great if you feel that suits you, but it just shouldn't be the only. Shouldn't be Hobson's choice. Shouldn't be the only option. And in order to cut down reviews, no, that's the local authority saying this suits us. Yeah. And if that's the only thing the reason it's being done, no, that shouldn't be happening. And say that I would have a good look at the report, the Independent Strategy Group.
So I think review of direct. So I'm assuming it's review of direct payment, and review of direct payment is not only just making sure the person spends the money, right? But whether direct payment is working and whether there are any problems and person needs help. So that will not happen if it's all done on based of database information from a prepaid card. And another thing that we noticed is that money is automatically clawed back. So you have 6 weeks worth or 12 weeks worth of your direct payment money. If it's on prepaid card, it will just disappear at a certain point. And that potentially is very problematic because there might be reasons for why this money is there, and there might be plans to kind of spend it, or a person might have spent it already, but they just haven't paid yet. And it creates a lot of problems, and we think potentially there might be a very contentious legal issue here. So prepaid cards as an option for people who want them, and not something as just take it or leave it approach.
Yeah, and the review is a really important time for people to express, you know, any particular troubles they might be having. So actually a face-to-face meeting is really important, and actually will be really important to meet someone's access needs as well. If actually they find talking to a human being, the reviewer can express, you know, it can be about safeguarding, it can be about all sorts of things, so that it's a really important moment for all sorts of reasons. So I think, whilst I understand the pressures on staff time, it doesn't sound like a very good way to do that.
Anne's asked us a question. Hello, Anne. Is the panel aware of any work going on with directors of local authorities to track compliance with the Care Act?
Straightforward answer, no. That would be really, really interesting to hear what's going on. I mean, I guess you're going to get some of the, talking about the Ombudsman, some of the issues coming up through cases coming up, so you can maybe put those together, but I'm not aware of anything specifically. So
unfortunately, this is one of our kind of asks as well, is that, so Ofsted, for example, would check children's social services, and there would be work to check compliance with all that legislation, and there isn't, as far as I know, I might be wrong, so please correct me, there isn't something similar to check compliance of adult social services departments with the Care Act. So compliance check will only be through judicial review or complaining to the Ombudsman, and we know not everyone could do judicial review, and not everyone would be able to go to the Ombudsman. Not because like we can in theory, but you know, people have difficult lives, and it might not be the first thing on their agenda.
And access to legal aid is significantly reduced. Access to legal aid.
Oh, so legal aid, yes.
You can't just get law involved just because you disagree. You have to qualify for legal aid, otherwise you have to pay a lot of money.
Inaccessible, in fact. or could be. So I mean, just from TLAP's point of view, it's not in terms of tracking compliance. Whether or not, I mean, a couple of years ago, the LGA, Local Government Association, did ask councils to self-report how they were doing in terms of implementation of the Care Act. And there was a series of questions around: are you just complying, or are you just compliant, or are you actually implementing the spirit of the law? And certainly from a TLAP point of view, we think there's a bit of a gap there between, and all the things you've talked about today really are really bringing to life that gap that we would describe as a rhetoric reality gap in terms of the Care Act. And we did do a Care Act survey for the Department of Health and Social Care a couple of years ago. I'm pretty sure it's still available on our website. So just one. Sorry.
I was just going to say just one other thought. I know time's a bit short, but I'm aware, local authorities mutually review each other. There's a better word for that. Peer review, that's the one.
Yes.
But talking about co-production, where, and I'm not aware of it happening, but it may well be. It'd be great to hear if anyone is. Are local authorities welcoming their own residents or other residents from another borough to actually review their services and actually flag up? So I think we get a slightly more, hopefully still sympathetic, but can I say realistic, honest, maybe slightly more targeted kind of review to flag up some of these things. Maybe it'd be interesting to hear if that's happening somewhere. Okay,
so we've just got time for one more question. And if there are any questions we've missed, what we'll try and do is, as part of creating a resource on TLAP's website, I think Local Personal's website, we'll make sure we respond to any questions we've missed in the session. A local authority who assists someone with physical disabilities, and it's a wheelchair use, the local authority will only allow use of direct payments for just care and payments for personal assistance. The person with disabilities want to use their self-directed support to pay for equipment and short breaks, but this is not allowed. What can this person do? Despite a review, their care planner and the social work team ignore the person-centred approach. What can be done to resolve?
Oh my gosh.
We're both nodding away.
That happens everywhere. So I think, there's adversarial approach. If you can get legal aid, you might want to have it depends on how long this was. If it was less than 3 months ago, you might want to have a chat with a solicitor who specialises in social care to try and challenge this, because that shouldn't, it looks like it is a policy, and this policy potentially is unlawful. Other way, you could complain to the ombudsman or raise an issue. Did the person, hopefully the person already told why they disagree and why they want to meet their needs in a certain way, quote the things from Peter's, send bits of the Care Act guidance from Peter's presentation, and see maybe that would help and focus the minds of social workers.
Obviously, legal is the ultimate position, but actually, and I know in terms of advocacy colleagues, it's kind of like, well, get very simple things, getting things in writing. Have you got it in writing what the reasons are that the local authority isn't allowing this? So it's really important to get and appreciate some people. That's not easy for some people, but to try and get some support to get a written response, either an email or a letter, as to what their justification for this is, because it's very clear in the guidance. Yes, it's guidance, but actually, if a local authority is not going to follow that, they need to have a very, very good reason. And you start to build up a trail, a written reasoning behind your case, and then if hopefully through a conversational approach and a co-productive approach, you can come to a solution. But because there really doesn't seem to be any reason, without knowing the specifics of the situation, why that's the case. But even if you have to get more adversarial, then you'll have built up a really good paper trail of what the issues are. So it should be hopefully more simple if you get to a legal point.
Just keep in mind that there's only 3 months window to challenge anything legally.
I hope that helps.
Thank you very much. Thanks very much, Peter. And we're getting towards the end of the hour, and now we're getting one or two big juicy questions going in. So we will, as I say, we will try and respond to those with some frequently asked question additions to the website afterwards, and we'll see if we can get the panel to respond to some of those. We're pretty much out of time, as I said. The recording of this session will be made available to those who've registered through directly. You should get a link to that by email. For those who've joined us afterwards or without registering on TLAP's pages, should I say, you'll also be able to access the recording on Think Local at Personal's website under events, I think probably. Do register to get our newsletter. You've also seen links to Inclusion London's website and also to Personalisation Partnership, contact details. We really hope that this afternoon's been helpful in terms of thinking about self-directed support going forward. Just the other thing to say is we all in the room, I think we've talked about peer support and connecting better and talking across each other, sharing practice better. There are a set of there are different networks up and down the country that could be really helpful to people in terms of promoting best practice. We want to try and connect those networks better. And,
people in the room. Absolutely. I mean, I've got a lot of experience of the London Self-Directed Support Forum, which is about people working in self-directed support, but also has a national conference with TLAP Indeed, where everyone's welcome. I do think and I'd add to that, Martin, not just about best practice, but also about sometimes getting confidence to challenge and to question in a constructive way, but is really important as well.
And we run Legal Network, obviously, where we bring lawyers together, and Peter has been to one of those. And we will try and also set up a network where we'll bring personal assistants in as well, because there are many big issues and they're not always supported as well as.
So watch for that going forward. For those who are keen to promote self-directed support going forward, better connecting across the country. So, from myself, thank you very much for listening.
Thank you very much and goodbye.
Yeah, thanks very much. A pleasure to be here. Cheerio.